So today's topic is surgical wound classification. Why is it important to classify the surgical wounds? So the classification of surgical wounds will help you to determine the risk of developing surgical site infections in your patient. So here we are classifying wounds into four types. So type 1 is clean wound. So clean wound is a clean incised wound. So according to your Sebastian, it is an uninfected operative wound in which no inflammation is encountered and the respiratory, alimentary, genital, or uninfected urinary tract is not entered. So, this is just a clean incised wound. It is not infected, there is no inflammation. Some examples I can give you are the thyroid surgery, the breast surgery, the coronary artery bypass grafting surgery, knee replacement, and uncomplicated inguinal hernia. So if that is clear, we will move on to our type 2 wounds, which is clean contaminated wounds. So here we enter the major tracts such as the genitourinary tract and the gastrointestinal tract, and but we enter it under controlled conditions and without unusual contamination. So the key point you have to note here is that there is no inflammation here. We are entering these tracts, but there is no inflammation here, and there is no infection here. So examples of this would be the elective or interval cholecystectomy, elective appendectomy. So in these cases, we are asking the patient to visit after a period of time. Let's say we are asking the patient to come after 6 weeks, after the inflammation has subsided. And now we are doing the surgery. We call it an elective surgery. And in this surgery, what we're dealing with is a clean contaminated wound. So these are the examples: elective or interval cholecystectomy, elective appendectomy, LSCS, lower segment cesarean section, laparoscopic abdominal hysterectomy, bowel surgery if the bowel is prepared with. That is our type 2 wounds, which is clean contaminated wound. Now the next type, which is the contaminated wound. So in the contaminated wound, that is the type 3 wound, we enter the GI or genitourinary system, but there is non-purulent inflammation. So here we're dealing with inflammation, but it is non-purulent. There is no pus discharge. There is no infection as such. So there is contamination. An example would be emergency cholecystectomy, so emergency appendectomy, and if the bowel is opened while operating a case of intestinal obstruction. So finally, we're going to discuss about dirty wounds. So what is a dirty wound? So according to Sebastian, dirty wound is old traumatic wounds with retained devitalized tissue and those that involve existing clinical infection or perforated viscera. So any neglected traumatic wound greater than 6 hours classifies as a dirty wound. So the 6 hours is called the golden period for a traumatic wound. So after the 6 hours, a traumatic wound, it becomes a dirty wound. So this is the golden period. Now what are the other examples of dirty wound? An abscess, a peritonitis, fecal contamination, all of this comes under dirty wound. So that is all about our topic on surgical wound classification. We have type 1 wound, which is clean wound, type 2 clean contaminated wound, type 3 which is contaminated wound, and type 4 which is dirty wound. To test your knowledge, I will be asking you a few questions. Now answer this quickly. What is elective cholecystectomy an example of? That's correct, a clean contaminated wound. What about an emergency cholecystectomy? It is a contaminated wound. Yes. Thyroid surgery, clean wound. And abscess, it is a dirty wound. Alright, so if you understood this topic, don't forget to subscribe. Also, click the like button, share with your friends, and visit for more videos. Thank you.